Hey, Dr. Johnson, as humans, we always try to get to the dentist a couple times a year for cleaning and checkup. What should we think about relative to our pets?
With them, it varies from the breed, the age, genetics, those all sort of overall health status, those all play a role. You cannot start thinking about oral health care, as I like to call it, too soon with your pets. As an example, with puppies and kittens, particularly in puppies, they can have retained deciduous or baby teeth. If they still have those deciduous teeth left after 6 months, then that's something that you want to bring up to your veterinarian. Get them comfortable right away with you being in their mouths. Number one, that's number one. And there's nothing better than brushing teeth. That's easier said than done in some cases, particularly with cats. Never use human toothpaste. I think most of us know that, but that's not safe. There's pet toothpaste out there. You got to find what flavor that they'll accept, that they'll lick off your hand, basically, number one. And then you have to gradually teach them to accept having your finger or the appropriate type of brush. And there's many different kinds that will be comfortable in their mouths so that you can reduce the amount of plaque and tartar buildup and try to keep the gums healthy. There are other oral conditions, both juvenile and adult, that we'll talk about more later. But I wanted to start talking about how do we get our pets used to, and how do we determine the best way to take care of their mouths. It might be the right kind of chew treat. It might be brushing. It's not, however, going to the groomer every 6 or 8 weeks and having them brush their teeth. If you brush your teeth every 6 or 8 weeks, it probably wouldn't do a lot of good either. So if you're going to brush their teeth, it needs to be done routinely for you to have a benefit from that. You want to start looking in their mouths right away. And as we get further into talking more about dentistry, we're going to talk more specifically. But I think it's important for people to know that oral disease, if left unchecked, can lead to other disease processes in the body that can affect the kidneys, the heart, and other organs. And so we want to make sure that we're paying close attention, and not just to the front of that mouth. We want to make sure we're looking at the back on each side, upper, lower, because those are going to be the ones that a lot of times people are going to miss that there's something going on up there. So make sure that your dog and cat are comfortable with you kind of just taking a quick glance in that mouth. But brushing, again, the right oral Oravet chews, those are different types of things that as long as they tolerate them GI-wise, can be very, very healthy for them. Dentistry, in terms of getting a dental as an adult, that's a conversation that you want to start having with your veterinarian when they're young. In other words, when should I get my first dental? That really depends on a combination of the philosophy of the hospital where you are, your breed and specific needs. There are certain breeds that tend to develop actual periodontal disease much quicker, and that's large and small depending on. And even cats, there are certain cats that we have to be more vigilant in terms of making sure that we're looking inside that mouth, paying attention to the breath, because they're not going to necessarily stop eating if there's a big problem. And a lot of people are under that false impression that, they'll stop eating if they have an issue. If they stop eating, then they've had an issue for a long, long time. So make sure that you take dental care very, very seriously with your pets.